Your feet might be sending you urgent messages about your heart. We often think of chest pain or shortness of breath as heart warning signs, but sometimes the earliest clues show up in your feet. Because your feet are the furthest point from your heart, they can act as an early warning system for circulation and heart health. In this video, we'll break down 5 warning signs in your feet that could point to heart problems, explaining the science behind each. The goal isn't to cause panic, but to empower you to notice these signs and have proactive conversations with your doctor. If you spot any of these symptoms, don't self-diagnose. See a healthcare professional for a proper evaluation. Let's dive in. First up, let's talk about swelling in your feet and ankles, a condition called edema. This is one of the most common and visible signs that something might be off with your circulation or heart health. It's not just about a little puffiness. Sometimes swelling can be significant enough to make your shoes feel tight, or even uncomfortable. If you notice your shoes are suddenly snug, or you see puffiness around your ankles, especially at the end of the day, it's worth paying attention. Try pressing your thumb gently into the swollen area for a few seconds. If your thumb leaves a dent that takes a while to disappear, that's called pitting edema. This is a key clue for doctors because it tells them the swelling is due to fluid buildup, not just inflammation or injury. But why does this happen? When your heart's pumping action isn't as strong as it should be, blood flow slows down and pressure builds up in the veins of your legs and feet. This increased pressure pushes fluid out of your blood vessels and into the surrounding tissues, leading to swelling. Over time, this extra fluid can make your feet, ankles, and even your lower legs look and feel puffy or heavy. You might notice it's harder to move around, or that your skin feels tight. Occasional swelling after standing all day or eating a salty meal is usually harmless and goes away with rest. But if the swelling keeps coming back, or gets worse, it could be a sign of something more serious. The real red flag is swelling that sticks around, even after you've put your feet up or gotten a good night's sleep. If elevating your legs or resting doesn't help, it's time to take notice. Persistent edema can also be caused by problems with your kidneys or liver, but when it's related to your heart, you might also feel more tired than usual or notice you're getting short of breath with everyday activities. Chronically swollen tissues don't get enough oxygen, which can make your skin look shiny, stretched, or even discolored. Over time, this makes your skin more likely to break down, get injured, or develop infections that are slow to heal. So, if you notice persistent, pitting edema, especially if it's getting worse or spreading, this is a clear signal that your body's fluid balance is off, and it often points to trouble with your heart's ability to pump effectively. Your doctor may want to check your heart, kidneys, and liver to find the cause. They might order blood tests, an echocardiogram to see how well your heart is pumping, or other imaging to get a clearer picture of what's going on inside. Think of swelling as your body's check engine light. It's your body's way of telling you something needs attention. So don't ignore it, or hope it will just go away on its own. If your socks leave deep marks, or if the puffiness just won't go away, make sure to mention it to your doctor. Even if it seems minor, it's always better to get it checked out early. Early attention and treatment can make a big difference for your heart health, helping you stay active, comfortable, and confident in your daily life. Next, let's talk about something many people brush off: chronically cold feet or toes, even when the rest of your body feels perfectly warm and comfortable. It's a sensation that can be easy to ignore, but it's worth paying attention to. This isn't just about stepping onto a chilly floor in the morning or walking barefoot on cold tiles. It's a different kind of coldness, one that lingers, no matter what you do. It's a deep, persistent coldness that doesn't go away with socks, slippers, or even heavy blankets. You might find yourself layering up, but your feet still feel icy and uncomfortable. Chronically cold feet are often a sign of poor circulation, which means your blood isn't flowing as well as it should to your extremities. Your heart works hard to pump blood through a network of arteries that gradually get smaller as they reach your toes and fingers. When these vessels are healthy, warm blood easily reaches every part of your body. But if blood flow is reduced due to narrowed or blocked arteries, your feet can become noticeably cold, sometimes even numb or tingly. One of the most common causes is peripheral artery disease, or PAD. In PAD, fatty deposits called plaque build up inside your arteries, making them narrower and restricting blood flow to your legs and feet. What's especially important to know is that PAD in your legs is a strong warning sign. It often means similar blockages could be developing in the arteries that supply your heart or brain, which raises your risk for heart attack or stroke. Cold feet may also come with other symptoms, like pale or bluish skin, slow hair or nail growth on your toes, or pain and cramping in your legs when you walk that gets better when you rest. These are all signs your circulation may be compromised. If you notice any of these symptoms, your doctor can perform a simple, painless test called the ankle brachial index, or ABI. This test compares the blood pressure in your ankle to the blood pressure in your arm to check for blockages. Don't dismiss cold feet as just a minor annoyance or something you have to live with. It could be your body's way of warning you about a much bigger issue with your vascular system. Addressing cold feet early and talking to your doctor can help protect not just your feet, but your heart and your overall health for years to come. Third, pay close attention to any blue or purple discoloration in your feet or toes. This is known as cyanosis, and it's a warning sign you shouldn't ignore. Even subtle changes in color can be important, so it's worth checking your feet regularly, especially if you have risk factors for circulation problems. Cyanosis occurs when the blood in your skin's small vessels is low on oxygen, which causes the skin to take on a bluish or purplish hue. This color change happens because oxygen-poor blood is darker, and when it pools near the surface, it's visible through the skin. In severe cases of peripheral artery disease, or PAD, blood flow can become so restricted that tissues are starved of oxygen. This lack of oxygen is what leads to the dramatic color changes you might see in your toes or feet. Sometimes, a small blood clot or a fragment of plaque can suddenly block one of the tiny arteries in your toes. When this happens, you might notice a sudden onset of pain along with a blue or purple hue. This is a true medical emergency, as the tissue can quickly become damaged without prompt treatment. It's not just blocked arteries that can cause cyanosis. Heart failure or serious lung problems can also lead to low oxygen levels in your blood. In these cases, the blood leaving your heart may already be low in oxygen, so your feet and toes can turn blue or purple even if your arteries are open. It's important to know that this kind of discoloration is different from a bruise. Bruises are caused by bleeding under the skin, while cyanosis is a sign of oxygen deprivation inside your blood vessels. The difference can be subtle, but the underlying causes are very different. On darker skin, blue or purple tones may be harder to spot. Instead, look for grayish or whitish areas, especially on the nail beds or the soles of the feet. These subtle changes can be just as significant and should not be overlooked. Another warning sign is mottling, a lace-like, patchy purple pattern that appears on the skin. Mottling can signal severe circulation problems and is often seen when blood flow is critically low. If you notice persistent blue, purple, or mottled skin on your feet or toes, especially if it's accompanied by pain, numbness, or a cold sensation, don't wait. These symptoms mean your tissues aren't getting enough oxygen, and you should seek medical attention right away. Remember, visible changes like these are your body's way of signaling that your tissues are in distress and your heart or circulation may be in trouble. Early recognition and prompt action can make a critical difference in your health and recovery. Fourth, numbness, tingling, or pins and needles in your feet, known as neuropathy, can signal heart-related circulation issues. While diabetes is a common cause, poor blood flow from PAD can also damage the tiny vessels that feed your nerves. The nerves in your feet are especially vulnerable to reduced blood supply. Early on, you might feel tingling or burning. Over time, this can progress to constant pain or complete numbness. Loss of sensation is dangerous. You might not notice injuries, which can lead to infections or ulcers. Neuropathy from poor circulation is a strong sign of significant PAD, which often means similar blockages in your heart. Heart failure can also contribute to nerve problems by reducing overall circulation. If you notice these symptoms, your doctor will check your nerve function and investigate underlying causes, including your heart and blood vessels. Don't ignore numbness or tingling. It's your body's way of warning you about possible heart and circulation problems. Finally, slow-healing sores or ulcers on your feet are a major red flag for severe circulation and heart problems. Healing requires a steady supply of oxygen and nutrients, delivered by healthy blood flow. If PAD restricts blood to your feet, even minor wounds can become chronic, non-healing ulcers. These ulcers often appear on toes or bony areas, may look punched out, and can be painful or painless if you also have neuropathy. A non-healing ulcer signals critical limb ischemia, the most advanced stage of PAD, and a very high risk for heart attack or stroke. Treating these ulcers is urgent, not just to save the limb, but to address the underlying heart risk. Management involves wound care, restoring blood flow, sometimes with surgery, and aggressive control of heart risk factors. If you or someone you know has a foot sore that won't heal, seek medical attention immediately. It's not just a skin problem, it's a sign of serious blood flow and heart issues. Those are 5 critical foot signs that could reveal hidden heart problems: swelling coldness, discoloration, numbness, and slow-healing sores. Your feet can offer vital clues if you know how to listen. If you notice any of these signs, don't ignore them. Talk to your doctor for a proper evaluation. Early detection can make all the difference for your heart health. Thanks for watching. If you found this helpful, please like, subscribe, and share. Stay aware, stay healthy, and see you in the next video.